And Robert, we'll hand it off to you for opening remarks.
Thank you, Hannah. Good morning or good afternoon, everyone. It's good to see all of you at today's webinar. Just by way of introduction, my name is Robert Espinoza, and I'm the Vice President of Policy at PHI. We are a national research, advocacy, and workforce innovation organization that's dedicated to strengthening the direct care workforce. And we're really excited about today's webinar and to see all of you attending this morning. I should also add that I have two hats today. I'm also on the board of directors of the Frameworks Institute. So it's a nice marriage of two organizations that I hold dear to my heart. Today's webinar is part of an advocacy skills series that PHI is coordinating in coalition with three coalitions in New Mexico, Michigan, and North Carolina. It is part of our Essential Jobs, Essential Care Initiative, which is an advocacy initiative in each state that's really focused on bringing advocates and organizations and individuals together to advocate for reforms that strengthen the direct care workforce. Of course, in effort to support their economic security, but also this care that older adults and people with disabilities deserve. We have heard from coalition members that there is a real interest in better understanding how to frame and message direct care issues, to persuade advocates, people in policy, and other leaders who are a part of this sector, and to really learn from what the research is showing about what constitutes an effective message. And as somebody who's charged with public education work at PHI and who's often thinking about what are the best frames and messages, I'm also excited to learn today from Moira and Marissa and hear about what the Frameworks Institute has been learning. So today's webinar is really focused on those frames and messages on care work and the research that the Frameworks Institute has done to equip us with kind of data-driven understanding of how to frame and message these issues. So I'm really looking forward to hearing from Moira and Marissa, to seeing the conversation that follows. And with that, I'm going to pass it to, I believe, Moira or Marissa, one of you.
Thank you. Thank you so much, Robert. And thank you, Hannah, and everybody at PHI for inviting us to talk about some new research that we've been doing. As we're going to be talking, we're going to talk a lot about the importance of having an evidence base for making your communications decisions. And we think about evidence base in everything we do, even the quality of the presentations and workshops we give. So in that spirit, I am going to launch a quick poll to sort of gauge how comfortable you are communicating about these issues. I'm going to ask you the same set of questions when we conclude to see how useful this webinar was for you. So if you bear with me, I will launch this poll. And Hannah, it's not letting me, so sorry, I'm having some difficulties. It's not letting me launch it because I'm not the original meeting host. I didn't even know there was such a thing.
Okay, it should be launched now.
Okay, it's launched. So I'll give you just a couple of seconds, maybe 30 seconds to a minute to answer. Okay, just a couple more seconds and I'll shut everything down. And you will have an opportunity to answer the same set of questions when we conclude. Okay, so I will shut that down. So welcome everyone. Again, my name is Moira O'Neill. I'm joined by my wonderful colleague, Marissa Gerstein-Pernot. We're from the Frameworks Institute. The Frameworks Institute is a nonprofit communications think tank. We do research across a number of social issues, and we try to figure out what are the most effective ways of framing issues in order to get to a point of more progressive change. I think saying that, I'm about to present some of the research that I'm most interested in or is my favorite research is almost like saying you have a favorite child. But it's true. We are so excited to be able to share this work with you, to hear from you, to see how it sort of sounds to you, what use it might be for you, and how it might inform your communications decisions. But where I want to start is actually at the end. So Marissa, if you could advance the slide. As a warm up, I'd like to take just a couple of minutes for you all to think about if you were to open your newspaper, although none of us really are opening our newspapers anymore, we're looking at our phones usually, and you could see the headline that you would want to see about our direct care workforce, what would that be? I want you to think big, like what is the vision? What do you want our public discourse to be like? So I will give you a couple of minutes to think that through, and please put your headlines in the chat. So anything you want. If you ruled the world and what you wanted to be realized could be realized, how would that be reflected in our media? Starting to see some great headlines start to trickle in. Give you just a couple minutes. So I'm seeing a lot about vision of the kinds of wages that we would pay our direct care workforce, how we would value our direct care workforce, how we would organize our healthcare system to better support that workforce along with the recipients of care. Marissa, are you noticing anything?
I am seeing the same thing. I also liked the caregiving becoming the #1 top rated job in the country. I think is fantastic. And I like that it's caregiving, which is a more expansive understanding of what care work could be. Yeah, these are fantastic.
I'll give a couple more seconds. But keep adding them as we speak. And the reason why we start at the end, or we start with the vision that you all have for our future and how we better support this workforce, is framing is a pretty important part. It's not the only part, right? All of the hard advocacy work that you all are doing is a big part of that. But framing is one part, the communications decisions that we make. that will help us realize this vision. And it's always good to have a really clear sense of where we want to go as we think about the framing decisions that we'll make. So I am going to pass it back to Marissa, who will talk to us more about the research we've been doing. But again, keep adding those headlines as you think of them throughout our discussion.
I think I've been inspired to think of one myself, which is by the comment about it being offered in K through 12. What if, instead of teachers and firemen and astronaut, kids said that they wanted to be a care worker when they grew up? I think that'd be a great addition.
That's a great one.
So I am going to go ahead and launch into particularly the research that we have been doing over the past couple of years on care work and the care work workforce. I'm just going to say in advance, you already saw one of my cats once. That might not be the last time you see a cat during this workshop, so I apologize in advance. The ongoing joys of working at home. So to give you all a little bit of background about where this work is coming from, where this research is coming from, is research that we've been doing now since, I believe it began actually in May of 2020 in response to the many events that began in, I think we're basically at the 2-year anniversary just about of the beginning of the pandemic, it being actually called a pandemic by the WHO, which was fairly quickly followed, but unfortunately, by the death of George Floyd, and then fortunately, the massive protests that rose up around his death, which then of course was followed by the election, et cetera, et cetera. So many funders recognize that this was a time when widespread social change might be affecting all sorts of different ways in which we think about the world and how our society is organized. And Ralph C. Jr. Wilson Foundation was one of the foundations that came to us to ask us to do some work on figuring out how people are thinking already about various things, in our society around the economy, around government, around health, and how those ideas or mindsets might be changing in response to the enormous events that had begun in the spring of 2020. So that was those were the underlying questions to this research, which is culture changing in response to these events? If so, how is it changing? For whom is it changing? And what are the effects of these changes for progressive issues and for advocates? So as I said, this is the work that we're doing around care work is part of this sort of larger project where we're looking at culture and how it's changing for whom, et cetera, organized around these sort of big topics of which care work is one. So we call this the Culture Change Project. It actually continues. We have another round of focus groups coming up in about, actually next week is when they start. So, and we are going to continue with this project well into the future. And this is how we have been conducting it. So it started in May 2020 with the first round of focus groups, and we've held them, let's see, this will be the 5th round coming up actually in a week. We've also done a culture tracking survey, which we've been doing bi-monthly since, first monthly and then bi-monthly since August of 2020. Asking similar questions to what we asked in the focus groups and also in what we call cultural models interviews, but in a quantitative form that allows us to break down data by different demographic groups. And I'll be showing you some graphs from that. And also what we call cultural models interviews, which are in-depth one-on-one interviews. And all of these have asked the people who are participating, members of the public, about their thinking about care work and the care workforce. So all of our work here at Frameworks is kind of grounded in this idea of culture and cultural mindsets. So the first step of framing is understanding how do people think about a particular topic so that you can then create and test frames that are going to help you navigate around those understandings and ideally cue understandings that are going to help you with your communications, build understanding, change people's attitudes, and build support for effective policies. So let's talk a little bit more about what I mean by cultural mindsets. So mindsets are default ways that we make meaning. They're widely shared, they're durable, and they're multiple. So what do these things mean? They're default in that they're sort of the things that we immediately think about when we hear about any topic. And an important thing to understand about culture and about cultural mindsets is that none of us is sort of an empty vessel. When we hear about something that we don't know a lot about, it doesn't mean that we're going to immediately understand the information that's offered to us in the way that communicator intended. We're going to bring a whole bunch of assumptions to this particular topic, even if we, don't know a lot about it or haven't even heard about it before. And these are default assumptions. They're usually very top of mind or something that we need to do a little bit of thinking about, but are there and we have access to it already. They're widely shared because they're embedded in our culture. These are ways of thinking that are available to everybody who lives in our society, who lives specifically in our culture and shares our culture. Some of these mindsets might be more dominant for certain people than for others, depending on our experiences, depending on how we're situated in society, depending on our background, but they're still shared, even if some are more top of mind for certain people than others. They're very, very durable. So mindsets might change, but the mindsets that are in our culture very rarely disappear. We might add to them. Some of them might expand to encompass new ideas, but they very, very rarely go away. And I'm going to talk about some mindsets that are deeply rooted in our history in a moment. And they're multiple. So we have various ways to think about any particular topic, some of which actually might be conflicting with each other. So no one person has one way of thinking about something. We all have multiple mindsets that we can draw on when we're thinking about any new information. And sometimes those things, you would think it doesn't make sense that I think this way and this way, but we do all the time. And you're going to see that in the data that I talk about. So the reason mindsets are so important, which I mentioned earlier, is that if we understand how people are thinking right now, we can move them towards a different type of thinking, which is what happens when we then create and test frames. And for this particular project, we have primarily been finding out how people think, so that we can then develop ways of communicating that we think will move people's understanding and their support. So I'm mostly going to be talking about how people are thinking right now. And this work is going to move towards that other part of the endeavor in the very near future. So here are some mindsets about care work and care workers. I'd say these are the ones that we see the most often. And I'm going to talk a little bit in a second about how they connect to each other. But these are the ones that people are really tend to be top of mind. And the ones that are on the left-hand side, you'll probably notice are maybe not the most useful, helpful ways of thinking when you're trying to communicate about care work. And those are oftentimes the ones that come up first. And then the ones that are on the right side are ones that we see very frequently in discussions around care work and also in our survey data. But a lot of times they're kind of deeper down. People need to think things through a little bit before they draw on them. And also they don't come on with everybody. Like some people say these things more often than others. So let me talk a little bit more about these different models, which is care work equals healthcare. So people go straight to doctors and nurses. That care work is what happens in hospitals specifically. That caring is character. So it's all about your innate ability to care in terms of whether or not you provide quality of care, that it's less skilled, but also that care work is emotional labor, which is something that we've seen a little bit more recently with people talking about how it's not just physical, it's about emotionally being there for people, particularly when they're isolated, and that context matters. So, I think heartening in a way that is helpful and makes me feel more optimistic. People are talking about pay, they're talking about work conditions, and I'll get into that a bit more. But I think, something we have to recognize is that then when you ask people about solutions, they're really not sure where they should come from. So let me get deeper into this. So there are very, very deep historical, durable understandings about the words care and about the word work that are shaping people's understanding that lead to those models that I just talked about. And I think it's important to recognize the fact that these are very, very deeply embedded in our culture, and they are always going to sort of mediate people's thinking when we talk about care work. So the first is that, and I'm sure all of you have noticed this, but I think it's worth talking about, is that the word care and the word work are very deeply gendered. And this, again, durability goes back to the Industrial Revolution and sort of the change away from an agricultural society and into a more industrial society. That's how deeply ingrained this is. And this gendered way of thinking is that work is something that's masculine, and it's something that happens out in the world outside of the home. It's public. So when people hear the word work, that's kind of where they go very quickly. Whereas the word care is about women, it's feminine, and it's about something that happens inside the home. And these things are really seen as generally in our culture as fairly dichotomous, whether or not in reality they are. And we know in reality that they aren't, but it's shaping people's thinking. And importantly, race complicates these perceptions because historically, women of color have always been more likely to work outside of the home. And they're also, in reality, to a large extent, and in people's perceptions, doing work in other people's homes. So that then kind of complicates the way people think about care and work. Although really interestingly, when we talk to people about care work and who does care work, people are very hesitant to talk about race. But race and immigrant status is clearly a big part of this conversation, even if people don't want to talk about it very clearly unless you kind of push them. So because of these very deeply rooted understandings of the words care and work, people see care work in very particular ways. So first, they see it as institutionalized, as I mentioned before. They think of it as happening in places like hospitals. It's happening outside of the home when they focus on that work part. They see it as generally menial. I think that's the combination of the care and work coming together is that people don't see this as something that's highly professionalized, which I'm sure all of you have encountered. And I'm going to talk about that a little more. We're going to actually look at some communications that talk about this. And then when people think and focus on the caring, they get very zoned in on the idea that you have to be caring in order to do care work. And that is 100% the most important thing. And I'm going to show you some video around this, but what's particularly important about this sort of caring is character and is done by caring individuals is that it sidetracks people away from thinking about the fact that this is also work, that people need to be paid for it, that they need to have good working conditions, that quality of care is really critical and professionalized. Instead, they get super involved with this idea that you have to be caring and you have to actually be doing care work out of the goodness of your heart and not for money, even though it's actually work. So I think this is something that, as I said, I'm going to show you some video, and it's a really important challenge for communications. So what do these actually look like in practice? How do we see these things in the world? So I'm going to show you a few examples. I'm going to show you examples of each of these. And the first is this idea that care work is institutionalized. So this is from our survey that we have been doing monthly and then bi-monthly, where we ask people what places come to mind when you think about care work. And then we ask people to check all that apply, so they can choose more than one. And what you can see is people go straight to institutions. They choose hospitals, they choose nursing homes, they choose childcare centers and home daycares and schools. So things that are outside of the home. And then homes is beneath all of those. So people choose it, but they're way more likely to choose the others, which again, definitely presents a barrier when you want to talk about direct care work and the care workforce that happens inside people's homes, because people don't think of work as happening in the home. So for the next slide, Maura's actually going to take over for this one.
So as Marissa was saying, understanding these mindsets gives us a way that we could think about the potential impacts of our communications decisions on those mindsets. So what I'd like you to do is to take a moment and to read the passage that you see on your screen. We're not going to name the author, but this is taken from Advocacy Communications. And given what we just heard about people's understanding of care work in the direct care workforce, what do you think might happen when people come across this particular passage? And I will invite you to write anything that you think in the chat. What will be the impact of this particular communication? Okay, so I'm seeing a lot of interesting answers. So Debbie says it sounds like a mother's job, not a professional career. Deborah is talking about how it minimizes the value of the skill and the knowledge that's required. And the primary focus is on the housekeeping duties. It's just, Sharon agrees, it's just doing light housework. It's very task-based work, Kezia tells us. But it's also, and another addition, it's also medicalized. They're talking about the person in a home as a patient. There's a lot of other words we could use to describe the recipient of care. Brooke, really good point. It doesn't personalize the work. And you really have no sense of how this kind of work will impact health outcomes. Yeah, and medical care is sort of an aside, right? Along with medical care. you know, that we're not going to talk about in any detail. And it really gives even though we have the along with medical care, because we have so much more description of the housekeeping tasks, that you get the sense that that's their primary responsibility. And Stephen, it makes a similar case, that the medical and patient, you know, we're alluding to healthcare, but we're not seeing the full complexity of a home health aide's role. Again, really good observations that we don't see the impact of this work. Dana, and I hope, as a person whose name gets mispronounced constantly, I am sorry if I am mispronouncing anybody's name. But the idea that the general public might, you know, think this is a problem that doesn't pertain to them because this is something that's happening over there and might not be something that I might ever need to experience of. Yeah, Stephen observes that we're sort of painting home health aides as glorified babysitters. We're not really getting a sense of the value. This is great. Marissa, do you see anything or have any observations?
No, but some people, I mean, I have many observations, but you all have hit on most of them. I did want to note that this was actually an introduction to a curriculum by an advocacy organization, which I find even more problematic in some ways. But I did already notice a lot of people were talking about what you could say instead, but I'm just wondering if we wanted to focus on that a little bit more.
Yeah, so if anybody wants to throw in the chat, what other things you would say? So Debbie talks about, and I think the way, Debbie, that you frame this is so interesting given what we're going to talk about next, but you say they have to be social workers, psychologists, and you're talking about all of the other kinds of activities that go on in the interaction between a home health aide and the person that they are caring for. And the professional skill that's required in all aspects of those activities. What other words also that I would be interested in hearing that you would use instead of patient? So in our first exercise, I saw a lot of people talk about care recipients. Sue talks about a home health aide as a valuable team member in the care of people in their home. That's great. I like the team metaphor. Care partner. Oh, I like that one. I like that one a lot. Participants. Jordan says we say participants are clients at our program. That's a good. Anything else that you guys would add to this? There's a lot to add. We could spend the rest of our time together. That's such a good point, Debbie, that you're not just working with the care partner, but often with their family members. And it's as someone who had a grandmother who needed a home health aide and also a child with a disability, they do become very important sources of support for you. You might not be the recipient of care, but they do a lot to get you through. Jordan makes the really good point that we often talk about these relationships in very passive ways, right? So someone is receiving services or being acted upon when in reality that relationship is much more dynamic, right? There's two people engaging in care rather than one giving and one receiving. It's really interesting observation. Sue makes a similar point. Okay, so this is wonderful, and the reason we're going to do this one more time, and the reason that we do this is, as Marissa said, we really are at the point of deeply understanding cultural mindsets around care work and the direct care workforce. But even though we haven't tested framing strategies, when we understand those mindsets, we can look at a passage like this, and importantly, we can look at our own communications and really start to critically examine the potential impact of our choices on public perceptions. Are we deepening a way of understanding about care work inadvertently often that we might not be wanting to do? So can we think about maybe sometimes very subtle shifts that we can implement to start to shift the conversation and shift thinking? And most importantly, build understanding and support for how we really need to rethink the system to better support this workforce. So I will stop there and hand the mic back to Marissa.
Thanks, Maura. And I did get a question, and I just want to clarify. I got so excited about getting into the mindsets that I went through the methods maybe a little too fast, that this research is being done with members of the American public in general. And so we are using that combination of methods, and the survey is a nationally representative sample of Americans across multiple demographics. And we try and also make the focus groups and other interviews as diverse as we can, but it is all members of the American public. So I am going to show you all a video that's going to talk about that sort of caring is part of your innate character mindset that we talked about. And I'm just going to go ahead and take it away because it kind of speaks for itself.
What are the most important things that come into play or factor in terms of determining or shaping the quality of the care that someone who does care work provides?
Have to have the patience.
I think humility would be an important quality. Empathy.
Empathy, loving, compassionate.
It's very selfless.
The selflessness.
Caretakers are a blessing. Like, you know, a nurse are like an angel almost.
The people that do that are angels.
Maybe it should be renamed angel care. You have to be a certain kind of person to do that.
You really have to have the passion to care for people.
You're doing it because you want to help people.
And just want to help other people.
You have to have the heart for what you're doing.
Well, you can't be in it for the money.
Not just doing it just because it's a job. You actually want to go out and help people.
If you don't care about anybody and you're in it for a paycheck, like Holly was mentioning, then you have no business being there.
So I love this video because it so clearly demonstrates that caring is character, that you have to be caring, and that's really all that matters for quality of care so clearly. And when we do these focus groups, and you probably saw me once or twice in there, that is immediately where people go because it's triggered by that word care. And what I find most fascinating is when people say, you can't be in it for the money, you have to do it because you care about the person. And I think that, other professions outside ones that have care in the name, like childcare, people expect you to be doing it for the money. They don't expect you to just be doing it generally out of the goodness of your heart. So it's a real barrier. Potentially, we can overcome it. So maybe I should say challenge to communicating about care work and the ways in which it needs to be, it is professional. It can be professionalized through training and through better working conditions and through better pay.
Marissa, I just wanted to, Sue made a really interesting observation in the comment that the word giving also may be triggering that understanding that this is something that you should not be in it for the money. I thought that was an interesting observation.
Absolutely. And we actually, something that we found in the very first set of focus groups, and because I've conducted so many focus groups, I'm focused on them as a source of data for this, although we have other sources. We actually asked people about care work and caregiving, and caregiving people assumed was something that you do for a relative. it really kind of sidetracked them from care work. So over time, we've started actually defining care work for people as work that is done in the home by direct care workers, in these various ways, so that people don't go so quickly into that, oh, it's healthcare, or are you talking about caregivers discussion, because we really want to get there thinking about care work specifically, but that is exactly what ends up happening.
And do I have time to bring up one more observation from the chat? Okay. So I think this is really interesting. Claudia says, I think people need to play up the selflessness of being a care provider because on some level, people are aware of how difficult and poorly paid these occupations are. And I think that one, I think, and I'd love to hear your thoughts, Marissa, is that I think we can talk about the wonderful people that caregivers are, and still at the same time really focusing in on the skills that they have and that they bring to this work, so that so not only are people aware of how difficult and poorly paid these occupations are, but the people start to demand that we do something different. So I think the message is to not, we still want to talk about, care workers as the wonderful people they are. But what is lacking in the discussion when we talk to members of the public is all that you say. You're a psychologist, you're a social worker, you have this medical training, you're part of a team that's responsible. And importantly, all these skills are brought to bear to improve health outcomes and well-being outcomes for so many parts of our population. But I've gone on. I wanted to know what you thought, Marissa.
Yeah, so I think ideally all of us, I think when we're interacting with anybody, we want them to be a caring person, absolutely. I think that the issue with at least starting or playing up the selflessness is that it does sidetrack people into that care versus work dichotomy that's really problematic. Because when we think about work, how do we value work? We value it with money. We value by paying somebody to do it. When we think about care, how do we think about care and the value of care? It's love. And it's something that we shouldn't be doing for money. So I think it might backfire if you start with it, because it'll make people think, oh yeah, so we don't really have to pay them that much or more because they're doing this out of the goodness of their heart. And if we are paying them more, we'll get people who only care about the money. And I think that that's also a real danger when we get into these discussions and when we're communicating about care work. We don't want, there's sort of, people do sometimes think about this like bad apples, that there are a lot of bad apples out there, and they don't necessarily think of them as not being great caregivers because they don't have the training they need. They're working for a company that doesn't treat them well. They need better pay so that they can take care of themselves and their families. They think they're bad apples because they're only in it for the money. So just something to think about when you're thinking about how you talk about caring. We're talking about care work.
There are more observations and questions, but I think we should keep moving, and then we'll leave some time at the end to get to them. Okay. But so thank you, everybody. Keep adding those questions and observations.
So it is true that people do have do think about the fact, and I think that this has definitely been the result of increased awareness of the conditions under which care workers in nursing homes, but also at home. I think, is somebody speaking in the background? Sorry, I thought I heard somebody talking. There is sort of a raised awareness about the fact that people who work in nursing homes and also do care work at home do need better pay and do need better working conditions, because there was so much media attention to this particularly in the summer of the pandemic, in the summer of 2020. So people do say, you know, they're really poorly paid, and I think they should be paid better. These are often the same people who a minute ago said they have to be angels in order to do this work. So that sort of back and forth between caring is the first thing that we think about as being innate, but I think they need better pay, but maybe they need to be more caring. People are toggling between these ways of thinking, that they need better working conditions. I think, again, particularly for nursing homes, people get very focused on how bad nursing homes are, and that's their perception, but also the work that people are doing at home with you know, patients, or who, you know, however they talk about them, as being very difficult and physical. But and they also have started to, there's this discussion around direct care workers being essential and then providing emotional care. And as you can probably guess, this term essential, which of course is also in the title of the series that we're working on, and this work in particular, started to have a lot of cachet during the beginning of the pandemic and be attached to a lot of different people doing different types of work. And this definitely has had an effect when people think about direct care workers. And I've just started to see recently more people talking about the emotional care that home health care workers provide, not just physical. That, again, I think the pandemic, because there was so much talk about isolation and care workers replacing family members, that people have sort of an increased awareness of that emotional role and the fact that conditions and pay need to be better, which I think is really promising. The issue is people don't have any idea how this happens when you ask them about solutions. We're going to talk about solutions in a minute. But first, I am going to show you some data that supports this idea that we are seeing in the qualitative data, that people are thinking about context much more over time and much more than we expected. So you can see here from our quantitative survey that the sort of endorsement of the context matters mindset is actually quite close to this idea that it's about your caring individual personality. So I'll be honest, I was a little surprised to see this data, even though I saw some of it in the focus groups, that it came through so clearly in this survey. And this speaks to the fact that we do have a great opportunity right now to change the way people are thinking about care work, to build up their understanding of what it is and what supports we need to be providing for care workers. So I'm going to show you a video that talks about this idea that care workers are essential and frontline, which of course is the metaphor that really came through, especially in the first year of the pandemic. So I'll go ahead and play this, and then I'm interested to hear everybody's thoughts about what's happening in this video.
So when you hear that term care workers, what comes to mind?
That it's essential work.
Sacrifice comes to mind too, you know.
Doing the necessary things that no one else wants to or is going to do.
They're more at risk than any American.
We're at war, you know what I mean? And I think with, you know, care workers being like the number one, we should treat them number one as if we were at war. They should not be wanting anything as far as benefits.
We basically are at war, just like with veterans and with military personnel.
They have that respect. We should take care of them because they're frontline workers in a war against a horrible disease.
You know, definitely underappreciated.
They should be getting paid much more for a service that is essential.
You know, at 8 o'clock at night, people be outside howling for the frontline workers, and you know, nobody's howling now. You know, it kind of just got, you know, people just kind of got numb.
So I'm interested to hear people's reactions.
Marissa, while people are putting their reactions, Deborah had a question to clarify what was being compared on the last graph. So I don't know if we want to just go back there for a second, and while people include their observations about what they just saw.
So what we did here is this was a question where we asked people to say whether or not they, very strongly disagree, somewhat disagree, neither, somewhat agree, or very strongly agree with two different statements. The first being that it's really about an individual's personality that determines the quality of care that people receive from care workers. And the second statement was about context, and context actually matters for quality of care that people are receiving by direct care workers or care workers. And then people were asked to mark down which of these 5 things they represents their feelings about both of those statements. And what we found is that when we actually averaged it out, that the percentage of people who said they somewhat agreed with that individual personality statement and the average number of people who agreed with the context matters statement is almost the same. So I personally had expected it to be much more skewed, and much fewer people would say, yeah, I somewhat agree with the context matters compared to the individual personality. So when I see this, what it says to me is there's definitely, I think, a shift towards more people recognizing that context is important. That doesn't mean that they don't also think that individual personality is important. So definitely some of the same people who agreed with individual personality also agreed with context matters. Probably a lot of them did. But they do have both of these ways of thinking, and more of them are using that sort of context matters mindset to think about care work and how it happens and what determines quality of care. So that's what that graph is showing. And we did also see it, we're seeing those same things in the qualitative research, which that video and other things that I've shown you are demonstrating.
And Sue had an interesting question too, and I actually don't know the answer to this. Did we ask people to indicate if they were or had been a care worker when we asked them to?
No, we haven't asked that. So it's a nationally representative sample. I don't remember exactly how many people are answering it, but I think it's a few thousand. So we could ask people that, but we probably wouldn't be able to very clearly determine, there wouldn't be enough people to very clearly determine in this survey how their thinking might be different from members of the general public. The sample would end up being too small. There has been some other work where people have, researchers have talked to direct care workers themselves about their perceptions and experiences in care work. So I know of one specific report that was done by a group in Michigan, which if I can find it during our Q&A, I will drop it in the chat, but otherwise I think in our follow-up email, we can send out a link to that. So I'm curious what folks thought in that video about the last person who was talking about how, it used to be that New Yorkers were banging their pots and pans for essential workers, and nobody was doing that anymore. Because I think that we are at a moment where we have a lot of opportunities we can see it in this data, to craft effective communications and really increase people's understanding. But we want to make sure that this wasn't just a moment of passing awareness, of care work and care workers and what they're facing and what they need to do well. Because awareness isn't enough, right? We need to make sure that people actually understand this work, how it happens, and how we can support it so that it doesn't go away in a year or whenever this pandemic ends and people move on to other things that seem more pressing.
Marissa, two people have brought up the fact of the war metaphor that people were using to talk about. And I think this is so interesting because typically I am very critical of when war metaphors are used, like the war on drugs or the war on crime or the war on poverty. We all know the impacts of that metaphor and all of those domains and the harm that metaphor has done. But there's something interesting happening as it's being used when they're talking about the pandemic. So I was just wondering if you had thoughts on that.
Yeah, I mean, again, I think the issue is that wars end. Whereas I prefer the word essential, because if something's essential, it transcends a particular moment or a particular conflict. So I also don't really love war metaphors, and I think it's interesting to see people talk about direct care workers as being like veterans, but I think that that kind of thinking might be more ephemeral, and we should think about, and we will when we're start testing frames, better terminology, better ways of explaining why care work and care workers are so important.
Bridget talks too about that the comparison may be problematic, but the idea that we would support care workers as we do veterans is something that we would want to sort of keep going.
Yeah, I mean, I think that's an interesting one too, that when we were having that in that video, when I saw people talk about that, because we don't treat veterans very well in this country. So, maybe that's a good comparison, or it could backfire. I actually am not sure, but something to think about, because people actually have a very dim view of the VA generally.
Deborah is just killing it with the observations today. I love this. She talks about how interesting it is the contrast to go from angel to warrior so quickly, and it's the same group of people, right? That does that sort of toggling between those two archetypes.
Yeah, that is really fascinating. I hadn't even thought about it, but again, it's like. I think the word essential, I'm guessing, I think we need to test it, is actually a much better word to kind of help people understand what it is that care workers do, and to keep people to sort of elevate their status in a way that is ongoing, as opposed to just within the context of the pandemic, which I'm not gonna predict that it's over, but at some point we'll have, sort of an end point that we've all decided collectively it has ended.
So I'm Pamela Stafford, and I don't know if I'm not saying your name in the right order, but what she says is that essential has to come to mean low wage workers, hasn't it? I mean, I think it encompasses a lot of people. Like we talked about doctors as essential workers along with others, and essential, necessary to sustain the quality of life, as Deborah. So I think it's interesting to see where essential goes as we move forward.
Yeah, it's and we have actually collected data on this as well. And yeah, so doctors and nurses are definitely sort of at the top when people say who they're thinking of when they think of essential workers, and care workers are a little bit further down. And then of course, like when we first started collecting data, is like grocery store workers were on there because they became considered essential workers. So I don't know if there's going to be like a bifurcation in terms of how people think about an essential worker or not. I think that's a really good question. My inclination at the moment is to definitely prefer the word essential to frontline, or angel or warrior.
Yeah, I agree. So Heather has an interesting observation, but it ties to our solutions conversation. So Heather, I'm gonna hold off on that, and we'll.
So when you hear that,
okay.
So one of the things that I have been finding, and Heather, this is directly to your point. So I'm going to read what Heather says. She says, I don't like the war tone, but believe folks are valuing care workers' service and acknowledging their personal sacrifices. So I think that is right on. We are also, at the same time that we're doing this culture change work, we're also doing a project on understanding public perceptions of long-term care services for older people with a very specific focus on public understanding of nursing home care. And one of the things of the advocates that I'm working on in that space is they diagnose the problem as people just don't value this workforce. And this research and the research that we're doing there, that I don't think that's quite the problem. People can value the workforce. Like we saw the video where they're talking about how essential people are. People can say work, and Marissa talked about context matters. They can talk about working conditions and how low the pay is. I think where people really get stuck is how do we do something about it so they can understand, they can value the workforce, they can understand the conditions. But I think what really gets people is where do we go? And that's a point where we see a lot of fatalism. So I wanted you to take a moment to read this passage and just talk through how might this passage reinforce that fatalism. So I'll give you guys some moments to write anything in the chat, and I will report what I see. And again, these are passages that we're taking from advocacy communications. I'll give you guys a minute or two. Yeah, so Sue writes, there's a problem, everyone knows it, but the solution you propose isn't feasible. The issue is closed before any solutions are proposed. So we're just left with how bad the situation is. And sort of getting them more money, that's just another issue. We're not even going to go there. We're not even going to talk about how we might do that. There's no solution there. And it's, as you guys say, it's sort of closing conversation. Yeah, Deborah, right. She says, I don't quite understand the statement. Being underpaid and getting them more money are the same issue. Very good observation. Stephen, right, that when we're talking about advocacy that's happening for the direct care workforce, that it's just intractable disagreement and solutions are impossible to advance. And I would say that sometimes in advocacy communications, that understanding is being reinforced, where people will propose a solution and say, but that'll never work because of X, Y, and Z. Or they start with the problem and how big the problem is. And then, you know, on page 44 of my final report, I'll give you some idea of what we might do moving forward. So Debbie says, I take this statement to mean we can't do anything to raise wages. That is not true. In Mission, we are doing something about this. That's good. Just hold on to that, Debbie, because I'm going to ask you to talk in more detail about what you're doing. But that's precisely what's missing from the public dialogue. Is there is something we can do. It's being done in certain places. It's having positive effects. And here, even if you're not an expert, even if you're not in the care workforce, if you're not in advocacy circles, you can understand how this might work and how it might be feasible. I think that's something that across the board we don't see as robust as other parts of the frame. So again, how bad it is for this workforce. Jordan, very good observation that the context for these statements matters. We're doing this as illustrative of the kinds of communications we might see. So I will provide more context. Not right now, though. I just want you to analyze the passage. Very good observation. Okay, so if we could advance a slide, Marissa. Okay, so what I'd like you guys to do in the chat, and I'll give you a couple of minutes, is to write one thing. You don't have to list everything. One thing that you are advocating for, you are working on, you know that is going on in another place, you've heard about, that you think is a really good way forward. That might be something that improves conditions for the direct care workforce and for all of the people that they support. I'm gonna challenge you to try not to use jargon if you can, and if you need to, define it. But just tell us one really innovative, cool, interesting thing that is being tried out or you're thinking about putting into place. So just go ahead and add it to the chat. I'll give you a few minutes to do that. And Hannah, would it be possible if we could save the chat and distribute it as part of our email? Because I think we're going to get a pretty interesting list of the things folks are doing.
Absolutely, we'll have access to the chat.
Thank you, Hannah. You're wonderful.
No problem.
Okay, so Stephen, wage floors, what does that mean? And Sharon, I would ask you to define standard occupational code. What I often do when I ask people to write out their solutions is I pretend I am my children when they were 2 or 3. And what is the question that you get? Why? How? Why? What means that? That's how my daughter used to say, what does that mean? It's actually a pretty helpful practice. For those of us, Marissa and myself, who are not experts, we have the great privilege of getting to be around you. But there's lots of things that you're talking about that we might not understand. So we're going to push you to make sure we can understand. I'm sorry, Stephen. Stephen said it's harder than I thought. Thank you, Sharon and Stephen, for adding that. And again, I'm not going to read everything, but we will circulate the chat so you can see this, because so many good things are coming through.
Well, I just want to call out Dana's because what she's doing is communications. I mean, several people said that too, but this one jumped out a little bit because it's a monthly column in our local paper. Communications is essential. I mean, obviously Maura and I are a little bit biased in this way, but we think it's exciting in addition to all of these really good solutions. Again, other people have communications, yes.
I see a lot of people talking about career lattices and career ladders. I'm interested in the difference between those two metaphors, if there is a difference. But again, if anybody wants to add a deeper explanation, I think Marissa and I can venture a guess, but it's always good to hear from you. Paid training, paid mileage, career constellations, Gigi. I'm interested now. I like the alliteration for sure. And again, I would invite you all to continue to add this. So sponsorships to CNA schools. Brooke, I know what a CNA is, but I think a lot of people can be confused. So sometimes it's helpful to spell out our acronyms. I think this is especially important in the State of the Union address, when Biden announced that he was going to require, or one of the things he was thinking about is implementing a requirement that their nursing homes that had access to 24-hour RN care. I think people don't understand the differences, what it means, what each sort of part of the workforce, what they are allowed to do, what they aren't, what is the impact of that. And so all of that sort of letting us in to what that means is really helpful.
I'm really enjoying the local or state-based solutions because I think sharing those, if they're happening in your own locality or state, for others, so that they can then think about how they could propose that as a solution, or vice versa, where you use another state as an example of a solution in your communications, if a successful solution, is really helpful as well. So it doesn't have to just be a national or profession-wide solution. It can also be more local and state-oriented.
Okay. Dana, we will be able to send you a transcript of the chat section, so you'll be able to see all this really good information. So we will send that out when we send out an email with copies of our slides and the link to the study that Marissa was talking about earlier about experiences, research that's been done with members of the direct care workforce. So I'll just say a couple of words about solutions. I'll start with a story. We have at Frameworks, we've been working translating the science of early brain and biological development, and with a really specific emphasis on early adversity for about 20 years now. And prior to having children, I would work with early childhood advocates that were working on all kinds of things, on childcare, on improving the quality of early learning centers, on just every thinking about child mental health. And I would be with them, and they would be talking about programs and services, and they would use a lot of jargon about the kinds of things that they were trying to implement. And I really could not wrap my mind around what they meant until I myself, with my child with a disability, had started to participate in lots of wonderful programs and services. And I think a really important message is, even though many of us have experiences or will need to rely on the direct care workforce, you shouldn't have to have direct experience to be able to really understand the kinds of solutions that you're putting forward. So some tips on how to do this is to make sure it's concrete, it's specific. You're better off explaining one thing, one solution, one idea that you want to put in place really well than listing everything you think that needs to be done, right? Because people can really wrap their minds about what it means. When we think about the solutions we're going to put forward, we can think about making sure that people can see the collective value and benefit of putting that solution into place. So when we support our direct care workforce, it doesn't just have impacts on the care partner, but the family members in the community, right? So you can really sort of draw out those circles of the collective benefits. Making sure that people can see that the solutions you put forth are feasible and conceivable. This doesn't mean that we have to be incremental, right? It doesn't mean that we have to sort of suggest solutions that are sort of tiny fixes to the system. We can think about sort of radically reimagining how we support our direct care workforce, just as long as we take people through the steps whereby we would reach those new visions, right? So that something is feasible doesn't mean it needs to be smaller or incremental. When we're thinking about especially who's going to be a messenger, that messenger is credible, that they are sort of advocating for this solution for the good of many and not just lining their pockets, and that we can really see the connection between the solution that you want to implement it and how it will address the problem that you are trying to solve. And one way to do this is to make sure there's a really tight link between your problem statement and your solution statement. So again, instead of listing all of the factors that, for example, result in really awful working conditions for the direct workforce, maybe you focus on a factor and you can connect it tightly to the thing that you want to do to be able to address that factor. And giving people that tight link between cause and solution will give them the tools that they need to for the next solution that they see to sort of make those links. So those are just some ideas that you can think about. But I think even if you can't get to, we call these the 5 C's. We work with a lot of linguists. They love alliteration. Even if you can't get to these 5 C's, just making sure that there is a solution in your communication when you're talking about these issues, I think is an incredible service to, again, us regular people, members of the public, who really care about this workforce. We understand how valuable they are, but we don't have a lot of information about the kinds of policy changes, systemic changes, structural changes that we might put in place to better support this workforce. And Marissa, do you want to do the key takeaways?
Let me unmute myself. Sure, yeah. So just to go back to what we learned and what we've been learning from the research that we've done so far is, fortunately, there does seem to be an increasing recognition of the value of care work. You heard people talk about essential and frontline and angels and all of that. But this valuing is pretty uneven and inconsistent. So, even though people will say that, then they'll also talk about it being menial. They won't really think about it first. They'll think about healthcare, et cetera. And it's inconsistent from person to person in terms of some people go, quicker towards context matters. Some people don't really get there in conversation at all. So this recognition that context matters, I think, again, that graph I showed you, I think is really remarkable that people are thinking about it, not only in this innate personality way, but also in terms of better pay, good business practices, professional training, although professional training, I should say, is a little bit further down the road for most people. They go to pay first. But that's a really great opening for communicators, for all of you when you're talking about the direct care workforce. But as I said, it's still mainly seen as about individual character. That's where people do tend to go first. And you saw that in that video. Sorry, I raced through that, but I want to make sure we have time for questions. And I just want to say quickly what's next for this project. So we are we're already in year 2, we're going into year 3, and we're going to start to get to the place where we dig into the research around reframing, where we develop different frames and a framing strategy, and then start to really test it with the research, and also do a lot more engagement as well. So you can see we did the public perceptions. We're about to do the frame and narrative development and testing. We're increasingly partnering with the field. So Robert has been amazing in helping us connect to different organizations. But I can't tell you how many times I've gotten the chance to talk about this work just in the past year or so, not maybe even 6 months. And it's been really exciting, not just talk about this, but to hear about everything that's happening in the field right now, which is really, really cool. So I think that is it. And then we have questions, although you all have been so amazing in the chat. I rarely get to work with a group of workshop participants that are that active. And so I hope we didn't already answer all of your questions and you for us.
Well, and I'll just echo the appreciation for the sort of deep engagement in the chat, as you all may likely have experienced. When you move away from in-person presentations, it's so hard to gauge audience interest, to get the energy from the crowd. So the fact that you all were so engaged really means a lot to us. So thank you. But still time for more questions.
Maybe we did answer all of them. How can we continue this dialogue is a great one. I feel like Robert should maybe jump in on that one.
Yeah, absolutely. Happy to step in, and thank you for leading such an incredible webinar. It's really exciting to see all the comments and questions and ideas. This is certainly we see an opportunity in each of the states that we're working on in essential jobs, essential care, to apply these lessons. We are working closely with coalitions in each of those states to map out roadmaps and advocacy activities. And I can imagine a lot of these lessons are applicable to those activities. So we'll follow up for sure in those states. We also are releasing a digital advocacy toolkit in November, where we'll share a number of these insights and more related to communications, related to framing and messaging, and related to other aspects of advocacy. So I think those two combined, I think will take us quite a bit in terms of the immediate future of this work.
And we do have a report on our website around this research, which we can send out the link to that as well. I think the digital advocacy toolkit will be very actionable, probably a lot more actionable. But on the other hand, being able to kind of see the research behind all of this I think is particularly useful to helping you think about, okay, what now in my own communications, what am I doing? What might I be cueing in terms of these ways of thinking that I do or do not want to be cueing? What are some things that I might want to stop doing? And what are some things that I might want to start doing, even without like a very specific tool yet, or a specific framing strategy yet? I think that the report could be helpful there.
So with no other questions, although we can take them, I can launch the quiz again. So I will go ahead and do that. Oh, I'm gonna. I'm sorry. I need to share the results from the first one. And here we go. Here's the end one. I'm gonna ask. Sorry, I shared those results. I'm going to launch the ones we want you to answer. So if you can re-answer the questions that you answered at the beginning of our time together, we would really appreciate it. And we are also happy to continue to take questions as you. Did Marissa, did it launch? It's
no, not yet.
Let me see if I can help here. Hold on.
Okay, thank you, Hannah. There we go.
Okay, and now let's try launching the next one. There we go. Hopefully you have access to it now. I see responses coming in, so it looks like you did receive it.
It's working. Thank you so much for your help, Hannah.
Of course.
Okay,
And maybe, I'm sorry. I just want to point out that we have our final series, our advocacy skills series event happening next Tuesday. So please join us. I just want everyone on the call to know that it's going to be building the relationships you need to win. And that's going to be facilitated by the Advocacy Institute. So please join us next week for that.
It sounds like a great one. I will go ahead and end the poll. Marissa, I don't know if you want to say something about the quote we put up as we leave for closing words.
Yeah, so I just really like this quote from Ruth Benedict in terms of just explaining the fact that people already have so many understandings when they come to any new information, and that we need to understand what those are before we start communicating, so that we make sure that when we do talk about something that's really important and that we care a lot about, we aren't accidentally pushing people towards understandings that we don't want them to be using to make sense of something that's so critical. So that's why I chose this.
Thank you, everybody. Thank you for all the work that you're doing. We hope we can just be of help. Stay in touch, as Marissa says. We will be doing a lot of engagement with you all, members of the field, as this research moves forward. So please stay in touch. Have a wonderful afternoon.
Thank you, everybody.